This is TTT Live. I'm DK Rosstar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We are bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, and on Facebook at TTT Live Online. We go now to the Minister of Communications, Donna Cox.
Good morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terrence Deyalsingh, the Chief Medical Officer, Dr. Roshan Parasram, and Dr. Saeed Rahman, Director, Veterinary Public Health at the Ministry of Health. The Minister of Health, the Honorable Terrence Deyalsingh, will provide an update on COVID-19 in Trinidad and Tobago.
Thank you very much, Minister Cox. Good morning to ladies and gentlemen of the media, and a hearty, today is what, Tuesday? Tuesday, good morning to Trinidad and Tobago, wherever you are this morning. We normally start with the global scenario. So as of now, today is the 5th of May. Globally, there are 3,671,548 cases. We have now crossed the 250,000 fatality number. There are 253,230 deaths globally. This is across over 200 countries and 2 conveyances. The total number of people recovered to date is 1,211,178. Minister Cox, I would leave the entire update to the Chief Medical Officer this morning because there is one issue that I would like to bring to the public's attention this morning, and that is the issue of testing. There has been much talk since coronavirus started in Trinidad and Tobago about testing. And now the issue is about antibody testing. I'm speaking in my position as a policymaker, not as a technician. That will be left to the Chief Medical Officer. But when you sit in a position of responsibility for the health and well-being of 1.4 million people, and the very valid questions are asked about testing, because we pick it up in the international media, and the questions are valid. However, being responsible for the welfare of 1.4 million people, we are the ministry setting policy. We don't have the luxury of latching on to fads, miracle cures, or using untested scientific theories. There has been much talk about why Trinidad and Tobago isn't using antibody testing since this came out in other countries weeks ago. It was actually raised in a motion on the adjournment in both houses of Parliament last week, and I had to respond. One medical doctor in the Parliament was suggesting that we should be using antibody testing in a big way. Ladies and gentlemen, the newest learning about antibody testing is this. And I'm just going to quote a couple lines from an article in the Washington Post, which is backed up by the FDA. You can go onto their website. I'll just quote you a couple lines. Officials said unscrupulous actors have been marketing fraudulent test kits and using the pandemic as an opportunity to take advantage of anxiety. It goes on to quote FDA Commissioner Stephen Hahn. He emphasized those uncertainties yesterday, Monday. He said, whether a test should be a ticket for someone to go back to work as the sole item, my opinion on that will be no, because there are so many unanswered questions. And this is a point both CMO and myself have been making since the discussion about testing started up. Goes on. Inaccurate tests can have serious consequences. Incorrect results could indicate people have immunity against the virus when they don't. Both the CMO as a scientist and myself as a policy maker have been saying that for the past month. Continues. However, flexibility never meant we would allow fraud. And he goes on to say, they have noticed some test makers have wrongly said their products have been approved or authorized by the FDA or could be used to diagnose COVID-19. Ladies and gentlemen, all 1.14 million people who we at the ministry hold dear. When we say we must adhere to protocols, I know that sounds sometimes to be dogmatic, but it's the adherence to protocols which has saved Trinidad and Tobago. We must stick to protocols even though there's public pressure not to do so in the short term. The Food and Drug Administration has now received praise for the change. The FDA made the right decision by walking back its policy on serology testing for COVID-19. This question was posed to both the CMO and I directly on this forum and in the Parliament. And he goes on to say, and this is the end of my quotes, even high-quality tests have limits and can result in errors. Ladies and gentlemen, I bring you this information because we have been taking a lot of body blows over the past month about testing. I think in the fullness of time now, we can appreciate that the CMO, myself, made the correct decision in sticking to CARPHA's gold standard PCR testing, which is 99.96% accurate. We did not jump on the bandwagon for hydroxychloroquine. We did not jump on the bandwagon for interferon. We did not jump on the bandwagon for remdesivir until it is proven to be effective. And we also did not expose this country to faulty serology testing because we understand the science and we are being led by protocols, not to be dogmatic, but to save the lives of 1.4 million people. One of the first countries to try to use serology testing was the United Kingdom. They bought over 3 million test kits. And do you know what they have to do with them now? Throw them away. Ladies and gentlemen, Trinidad and Tobago's long-term approach to testing is scientific, and in the fullness of time now has proven to be effective, safe, and in the best interest of all Trinidadians and all Tobagonians. We at the ministry will not give in to fads and public pressure to do anything that jeopardizes the health, safety, and well-being of anybody in Trinidad and Tobago. We stand by protocols, and the Chief Medical Officer and myself will do all that we can to bring only high-quality, safe, and effective products to Trinidad and Tobago. Minister Cox, I thank you for that opportunity.
Thank you very much, Minister. At this time, the Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update.
Good morning, Ministers, members of the viewing and listening public. So the clinical update as of Tuesday, the 5th of May 2020 is as follows. The samples submitted now to CARPHA as well as UE's test site are 2,055. There have been 332 repeat tests over the period. Number of unique patient tests stands at 1,733. Number of positives remain at 116. In terms of patients, we have discharged thus far 102 patients, leaving a total of 8 patients within the system. So there's 1 patient left at the Couva Hospital. That person is now in the high dependency unit. There are 5 persons in the home of football. As we would have noted yesterday, there's no one at the Sandy Grande facility at this time. In terms of persons who would have been quarantined, there are 69 persons in the UE DAB campus awaiting their quarantine period to end, and the persons at the Tacarigua facility, 33 persons will be discharged at some point during today. All of them, all 33. There are 16 healthcare workers at the Napa. They are for variable lengths of time still, because some persons would have been added over the last few days. They will continue to go through a 14-day period before they can be reintegrated into their family and the workforce. Thank you, Minister Cox.
Thank you very much. At this time, Dr. Saeed Rahman, Director, Veterinary Public Health at the Ministry of Health, will speak on COVID-19 workplace public health measures. Dr. Rahman.
Honorable Ministers, Chief Medical Officer, members of the media, viewing public, good morning.
Good morning.
The Ministry of Health has been tasked with the responsibility of assisting the business community in readiness for the upcoming lifting of current restrictions in the country as we move forward towards the road to recovery and the new normal that we must all get accustomed to. In order for this seamless transition to happen, there must be a paradigm shift by all stakeholders, employers, employees, as well as the public they serve. A committee established by the Ministry of Health has been mandated to work with the business community in an attempt to identify risks in the establishment and develop mitigating strategies to prevent the spread of COVID-19. In addition to the normal hazard prevention strategies that already exist at many of these establishments, such as their engineering controls or the use of personal protective equipment for hazards in the workplace, all employers should now develop and implement infection disease strategies geared towards COVID-19 by establishing committees within their companies to undertake risk assessment and develop prevention control strategies. Guidelines have already been developed for supermarkets and road and street vendors, and currently our Public Health Inspectorate is conducting surveillance to determine compliance with these guidelines. These guidelines, as well as those that we will develop, are centered on core principles such as social distancing, frequent and adequate hand washing, facilities and surface sanitation, respiratory hygiene and the use of personal protective equipment, procedures to address sick employees, as well as employee education. Employers must ensure that all employees keep at least 6 feet away from co-workers and the public when feasible. Other prevention measures required may not allow for this, and therefore the use of barriers to block sneezes and coughs, as well as ventilation improvements, such as opening of windows when social distancing is not feasible. At the workplace, social distancing may be achieved by moving workstations further apart, reducing the number of workstations in use at a given time, moving certain tasks or meetings to times or locations with fewer people present, controlling the number of persons entering the building or office, staggering work schedules so workers don't crowd when they arrive or when they leave work. Slide 2. Use dividers or floor markings to distinguish appropriate spacing for people waiting in lines or in front of service counters. It is important, just as with respect to our OSHA requirements, where we have responsible persons within an establishment. For COVID-19, we must designate employees to be our physical distance monitors. It's important to stagger our breaks and our lunch schedules to minimize occupancy or limit numbers of people in lunchrooms and other places. At present, we are advocating the use of virtual online meetings, text messaging via WhatsApp group or other social media to prevent crowds gathering for such meetings. One of the very important core principles is that of frequent and adequate hand washing. It's important for all businesses to provide enough fixed or portable water stations for workplace or job sites so that employees can wash their hands frequently with soap and water. It is therefore necessary to ensure adequate supply of soap, water, and disposable towels, and to set schedules for frequent restocking of these supplies, as well as collection and removal of trash. Workers should be required to wash hands frequently and effectively when they arrive at work, when they leave their workstations for breaks, when they use the bathrooms, before and after having something to eat or drink, and even if they go outside for a smoke break, although the Ministry of Health does not promote tobacco use. It is important that supplemental hand sanitizers also be provided with a minimum content of 65% alcohol, as hand washing may not always be available. Gloves may be provided, but they must also be washed and should be used by those who are involved in cleaning or those who may have a sensitivity to frequent hand washing. Respiratory hygiene is most important. As you are aware, COVID-19 spreads via droplets emanating after coughs and sneezes. So it is important that you make sure that those around you follow good respiratory hygiene. This means covering your mouth and nose with either a tissue that is then disposed of in a bin, or by sneezing or coughing into the crux of your elbow, as was mentioned previously. Personal protective equipment is also helpful when social distancing and other protective measures are not feasible or not effective. Face shields can prevent direct exposure to sneezes or coughs and are utilized, for example, by cashiers and others that have direct contact with customers. They should also be provided to staff who are involved in cleaning so that cleaning chemicals and disinfectants do not get into their eyes. The use of respirators, as mentioned before by the minister and others, such as the N95, should be restricted for medical use. It is appropriate, however, that face masks made from cloth, and these can be made at home, you do not need to purchase, they can be homemade, must be worn by workers as a best practice to prevent the wearer from transmitting droplets from cough and sneezes. It is important to know that cloth masks do not prevent inhalation of very fine particles and therefore must be used together with social distancing. Workers should not touch their face, mouth, nose, especially when putting on or taking off PPEs. Slide 3. Routine and frequent cleaning is required in all establishments. There's a need to establish a regular housekeeping schedule to address frequent and periodic cleaning. It is no longer sufficient for cleaning at the end of the day, but cleaning should be done frequently and should be prescribed using a standard sanitary operating procedure. Establishments should therefore provide necessary equipment to facilitate these cleaning procedures, as well as a large provision of diluted bleach solution or other approved disinfectants. It is important to understand that cleaning must precede disinfection. Many of the disinfectants, such as our diluted bleach, do not work in the presence of organic matter, and therefore floors and other surfaces should be cleaned with soap and water to remove dirt before application of these disinfectants. Ensure that employees follow the cleaning procedure and use protective gloves and face and eye protection when mixing, spraying, and wiping with liquid cleaning products, such as diluted bleach. It is important to remember that businesses also have fleets of vehicles which should also be cleaned and disinfected regularly. All businesses should keep material safety data sheets so that the requirements of proper mixing be followed.
we must also stress, do not mix chemicals. Many cleaning agents are not compatible with one another, and if you mix them, it can result in the emission of hazardous gases. Okay. Despite our best efforts, employees will become sick at times. It is therefore important that employers require sick workers to stay at home, or if they become ill on the job, to ensure that they return home. If those who have signs that are exhibited similar to those mentioned for COVID, then those individuals should be isolated and transferred to a health facility as soon as possible. Following these type of suspected cases, our facilities should engage in deep cleaning exercises so as to make the environment safe. Keep workers away from those areas that are going to be deep cleaned. Last but not least, employee education is very important. All workplace hazard education about coronavirus must be provided by employees, and it must be provided in a manner in which they will understand. Sometimes our employees may not speak fluent English, and therefore we should ensure that the risks are communicated to them in a manner in which they will understand. All employees should know the signs, symptoms, and risk factors associated with COVID-19, how to prevent the spread of coronavirus at work, including steps being taken at the workplace to establish social distancing, frequent hand washing, and other precautions. The importance of hand washing and how to effectively wash hands must be taught. Do not expect that workers will know how to engage in proper hand washing. It should be taught to all of them. Proper respiratory etiquette, including, as we spoke before, cough and sneeze etiquette, as well as avoidance of touching of the face, should be emphasized. It is important that these messages be communicated regularly through readable signs and through messaging. Provide ways for workers to express their concerns and ideas, as they may have some ideas that may improve safety at your establishment. Since the onset and the declaration of a pandemic of COVID-19, the Ministry of Health and the Government of Trinidad and Tobago have been advocating these core principles through their daily briefings. We have also been going out to communities on loudspeakers and emphasizing the same. It is, however, a corporate responsibility to ensure that these policies and guidelines are adopted and implemented by each establishment, so as to ensure that their employees, their customers are protected, and ultimately the viability of their business. I thank you for giving me this opportunity to address you.
Thank you very much.
Very good.
Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. 98.1.
Good morning to the panel.
Morning.
Stephen,
Good morning.
90.1 FM. 2 questions quickly. One for Dr. Parasram and the other for Minister Deyalsingh. Minister Deyalsingh, my question to you relates to electronic data privacy control protection and surveillance. What can you say or is being done to ensure patient confidentiality is maintained on this front? How much of this is really being protected from, let's say, tech companies or persons who may have the ability to infiltrate secured medical information service systems? And Dr. Parasram, having regard to the numbers we are seeing in the last, we have been seeing over the last couple of weeks, and the apparent levels of stabilization of the virus in terms of our management of it, We are now up to, 102 persons being discharged as against 116 positive cases of the virus. How do you see the curve for Trinidad and Tobago at this moment?
Okay, so I will take the first part of the question. As you know, Mr. Cummins, on this platform, I have been criticized for not divulging patient information. I have been coerced, cajoled into talking about certain individuals. And it's a principle I stand by, because a healthcare system can only work if patients feel comfortable that their Minister of Health will not speak their business publicly. Having said that, at all RHAs, we take the issue of patient confidentiality very, very seriously. But like any system, there could be breaches, and we have built-in firewalls. But in these days of electronic devices like phones, we have seen where patients' records unfortunately get out into the public domain. We continue to work with all the RHAs to ensure that patient confidentiality is a hallmark of our systems, and this is a fight that we do every single day. However, as you know, no system is 100% foolproof, but we have to rely on people's inherent integrity, that even if they get something on social media, they don't share it. It's a collective responsibility, Ministry of Health, RHAs, and the public. Thank you very much.
Right. In terms of the epidemiological status, we are, as you know, our last case positive would have been, I believe, on the 26th of April. So we well into over a week. We have not had a positive case, aside from the fact that we have been increasing our community surveillance. So we're now up to 471 tests being done. So far, all of them are negative. I think we still, I still have, from where I sit, I continue to be, I have to be as pessimistic as possible. Just to ensure that we're not missing something that is occurring as a hidden phenomenon. So, I mean, on the surface of it, it seems like we're doing well so far. In terms of the number of cases, we keep an eye on the last two in particular, which are the ones that I was concerned about in terms of developing clusters around it. So we let us go the full 14 days from those cases, from at least the last one. We'll have a better idea if there was any clusters developing. But I think we are progressing well in terms of the epidemiological profile. We remain listed as sporadic, meaning there's no cluster formation and there's no community spread in a major way in terms of WHO profile.
Thank you very much. Chester, I think it's Guardian Media Limited.
Yeah.
Yes. Hi, good morning, everyone. Chester
Morning.
Sombrero, Guardian
Good
Media.
morning.
All right, so Dr. Parashram, since the 69 people returned from Suriname, has anyone else been able to or granted exemptions to enter the country? Or are you aware of anyone being granted exemptions to come in at least up to the 15th of May? And my second question is, you mentioned last week by today you should get a report on the inspections at the private institutions who have the PCR machines and have applied to do testing. Can I get an update on that, if possible?
So
please?
I will take the first question on the issue of exemptions. That is under the remit of the Honorable Minister of National Security. And we just play a supporting role, so I will not be able to comment on who has been given exemptions or how many. Thank you.
Yeah, so we would have gotten a total, I believe, of 5 persons applying or sending in documents to the Ministry of Health. 4 persons were inspected, I believe, up to yesterday. There's 1 person that withdrew from the process temporarily because they need to supply they want to supply some additional data and be in a better state of readiness. So we are in the process of compiling those reports, and which I will send onwards to PAHO and CAFA so that they can have a look at it as well. We'll come together as a team very soon to look at what we find, and then, of course, we'll be in communication with those institutions.
Thank you, Doctor. Express.
Good morning, Dr. Reyes.
Morning.
Dr. Reyes from the Trinidad Express. I have 2 questions.
Mm-hmm.
One is for Minister Deyalsingh. The other is for Mr. Rahman. Mr. Deyalsingh, Minister Deyalsingh, could you say, well, now that the San Grande step-down facility is now free of patients, is the rental agreement with the center's owner still in effect? And my question for Mr. Rahman, can you say whether businesses can call the Committee for Help, and will material be printed for distribution with workplace measures recommended?
Yeah, so I'll take the first question. Coincidentally, we met with all the CEOs this morning, and the CEO of ERHA has confirmed this morning that the rental agreement was for 3 months in the first instance. Whilst there is no one there now, like the CMO will say, if we give it up and then you have a surge in cases, what do we do? So we are weighing the pros and cons right now with the CEO of Eastern RHA, looking at our entire COVID setup, from convalescent care, care for suspect cases, care for confirmed cases, step down, and we are now have to weigh where we go forward with all of these. So that is a discussion that started this morning with the CEO of Eastern and the CMO, and they will make a decision moving forward. We can't give you a hard and fast answer now because, as the CMO says, you have to prepare for the worst. You have to prepare for the worst. What happens if a second wave hits us and we don't have facilities? Then you will ask me, why don't I have facilities? So this is one of the things, you're caught between a rock and a hard place, but as the CMO says, you have to prepare for the worst and hope for the best.
Dr.
Okay,
Rahman?
I can take the second one.
You can take the second
Yeah.
one? Okay.
So basically, the committee was set up under the office of the CMO. It includes some private sector entities, but predominantly public health specialists from the Ministry of Health. So it is a Ministry of Health team. So in terms of calling on what if someone needs assistance with their workplace, they can write or call to the Ministry of Health, either the office of the PS or the minister or the CMO or the minister. In terms of printed materials, the guidelines will be disseminated as wide and far as possible as soon as it's complete, which should be in the next couple of days, trying to get to most of the private and public sector entities. We will try to do it electronically as well, but the most important part of it is, as Dr. Rahman would have indicated, we're trying to get the public health inspectors to actually go into as many places as possible to discuss with them the intricacies of the guidelines that Dr. Rahman had spoken to, so that not only it is something in paper that sits on a shelf, it has to be something that is operationalized and operationalized in a very short time frame. So the Public Health Inspectorate will be utilized both at the Ministry of Health as well as the regional corporations and local government to ensure that the guidelines are adhered to as well as known to all the agencies.
I just want to go back to the first part of the question briefly. Throw your minds back to when we had to accommodate 68 people from the cruise ship. And because we were proactive in renting the Balandra facility, you realize we were able to do that seamlessly. The issue of facilities is one that is a thorny one, but we have done well so far. The focus on the San Grande facility, I understand why the focus is there. But in responding to a global pandemic, let us learn from other countries that did not prepare, did not have facilities. We were not in that position. So whilst what happened at San Grande seems to be a cause célèbre, as a Minister of Health, it is my duty to oversupply space because we don't know what will hit us tomorrow. As the CMO has just said, suppose we get 2 clusters tomorrow and we hand over all the space and say, okay, everything is fine and dandy. And we turn over all the spaces that we have rented. We decommission the Racket Center. We decommission Balandra. We decommission San Grande. And then I'm hit now with 150 cases. Then the question will be asked of me, why didn't I prepare? So it's a very difficult position that we are in, but that difficulty is mitigated by over-preparing, and as the CMO said, you prepare for the worst. And that is what we are doing.
Thank you. I-95.5.
Good morning to everyone with Field Dinner from I-95.5. My two questions are for, I believe it's Dr. Rahman. I hope I have the name correctly.
Yes.
Doctor, based on the recommendations you outlined earlier, would you say that employees who return to work and don't find that those recommendations are being implemented in the workplace, do you think that they would be within their rights to refuse to work under those circumstances? And my second question, as we look down the road to living with this virus long term, would you say that lining up outside of every institution we wish to do business at will be something we'll also have to live with, or do you foresee a solution to maintaining physical distancing without the need for those long lines outside?
Minister?
Yeah, so let me just shine some light on that. The issue of lining up and so on, I'm glad you raised it. People like me who are, I won't consider myself to be technologically savvy. I have to make a paradigm shift. People like me, instead of lining up outside a bank for every single thing, my son doesn't go to the bank. He does everything online. We are going to have to change the way we interact with institutions. So like banks, I think there ought to be a serious education program to convert people like myself who like to line up outside banks to start to adopt the e-platforms for paying bills. That is one way to mitigate lining up outside. You are going to see, and it has already started, that many groceries and places of business that are open are now moving to in-store shopping to curbside pickup. So you WhatsApp your prescription. I think a popular pharmacy chain has done it. You WhatsApp your prescription and you collect it in your drive-through. Many of the bigger groceries, you send in your grocery list, they put it aside for you, and you pick it up. That is going to be some of the paradigm shifts we are going to have to make as we adapt to the virus. We are all, young, old, middle-aged, are going to start to have to use technology a bit more and take advantage of things like curbside pickup and so on to mitigate risk.
Thank you. I think there was another question. There was
to Dr.
two
Rahman.
questions.
To Dr. Rahman.
Dr. Rahman?
Yes, so as mentioned before, necessity is the mother of all inventions. And I think we have to look at the situation going forward. And as Minister rightly said, we need to find unique ways to cater to these problems, whether it be using electric platforms or doing business in a different way. And we have already seen that many businesses are moving in this manner. For the second question, which is really an occupational health concern, I think that is best addressed by the Ministry of Labor, and we will be working with them to make sure that employers adopt these policies and guidelines. Someone obviously should not put their health at risk, and therefore it is important for employers to have these policies and to maintain these policies to protect their employees, their customers, and their business. And it is important for us as the public to also look towards choosing those businesses that give quality service and look at our health as a primary concern of theirs as well.
Thank you, Doctor. Priya Bihari.
Hi, good morning. Priya Bihari, AZP News. Minister of Health, I just want to ask you about, we only have one patient left at Cuba. We have 471 tests in the community, all negative. Are you now in a better position to advise the Prime Minister that we can lift some of the measures under the public health under the public health ordinance and lift some of the measures, especially the ones that deal with the opening hours of businesses?
So as we have said from this platform, time and time again, the Prime Minister makes that decision, and I'm sure he will consider all relevant factors.
Astronaut, health news.
Astronaut Health News, Gwyneth Stewart. Good morning, everyone.
Morning.
I'm not hearing the head table. However, Dr. Rahman, thank you for your report. Congratulations on the excellent strategies. And have you considered the possible impact of conducting regular chemical cleaning during the hours that most employees are still present on the compound? And what safety mechanisms can be employed? And my second question is from a concerned senior citizen who is in receipt of the Widow and Orphan Fund. So I don't know who will answer this, but she normally is required to sign a form every April. But well, she wants to stay in line with the safety measures for senior citizens, especially in this COVID-19 time. So she tried calling the Treasury and as well as checking online, but she wants to know what procedure, what action she has to take in order to still remain in receipt of this fund.
So I will take the second part of the question. I will certainly pass on that concern to the relevant authority. There is no one here this morning from the relevant ministry who could answer that question, but I will certainly pass on the concern.
Dr. Rahman?
So with respect to cleaning operations and disinfection during normal operation hours, it is important to understand that many of the materials that we are advising you to use can be used during normal working hours and while people are at their place of work. So for example, our recommendation for 5 tablespoons of bleach in a gallon of water, that quantum will not affect people during their normal workday. Other types of cleaning we will look at, and that is why we're working with industry and with facilities to see what is their intended plan. So for example, a lot of people have been looking to using methodology such as ULV fogging, which cannot be used during work hours because it requires 2 hours of air exchange. And so we are working with them so that they can choose the best and most appropriate cleaning and sanitization methodology for their particular business.
Dr. Rahman, could you just confirm, because this is a very good conversation, that businesses don't have to buy expensive cleaners and simple diluted bleach and water is sufficient? Could you confirm that, please?
Yes, I can confirm that. First of all, for cleaning, soap and water is your best agent against COVID. As was mentioned before by Dr. Rampal, the virus is a lipid-covered virus and is easily deactivated or inactivated by soap and water. So cleaning with soap and water is first, and then simple disinfection with, as I said, 5 tablespoons in a gallon of water, bleach to water ratio, will be a very cheap and effective means of sanitizing.
The point I want to get through to the national population is that this method of cleaning and disinfection does not significantly add to the overheads of any business. It's cheap, it's inexpensive, and effective. That's the point I want to get through this morning. You don't have to buy expensive, fancy chemicals. That's the main point. Thank you.
Thank you. Yolande Thomas?
Hi, good morning, Yolande Thomas from CL Communications.
Morning.
This is for the CMO. I wanted to ask him with regards to the 69 persons at the UE campus. I know they were swabbed last Saturday. Is there any information with regards to that?
Yeah, the county medical officer for that area would have received the swab and the results and given those results to the patients themselves. As you know, we can't divulge the results of the swabs.
Remember, the first question was patient confidentiality.
Loop TT?
Hi, good morning, everyone. This is Nika Pasanal here from Loop. I just had a quick question for Dr. Rahman regarding, you explained quite a lot about workplaces, business places, that sort of thing. But what about schools? Is there anything you can, at this point, recommend that schools engage with regards to sanitization? Because, I mean, it's a dozen or more children in a classroom. How would you recommend they go about adjusting?
So we are looking currently at the recommendations of CDC for schools. Obviously, this is a challenge. The amount of people in a small room, classrooms are usually housed with an average of 25, sometimes as much as 40 students. And so social distancing is difficult, but we fortunately have a little timeline to work with, that schools are not being reopened until September. And hopefully by that time, we will have more clear guidance from the CDC on how to deal with this. In the interim, I understand that many schools are utilizing the virtual platform to do classes and to use email and other social media to communicate with students. My children themselves are involved in some of these at their schools. And I think many schools themselves are developing protocols that we will look at, and subsequently we will make recommendations.
TV6.
Morning.
A question to Dr. Rahman. How long do you estimate it would take for all the sectors and all the employers to put the necessary infrastructure in place and the general environment to ensure that they comply with these measures? And do public health officers have any type of enforcement powers to ensure adherence to these measures? And to Minister Deyalsingh, someone reached out to me whom I know personally, and this person had had flu-like symptoms for over a month and developed a cough with mucus and these types of things. Went to Mount Hope and was swabbed, but the swab was rejected because she did not have contact with a primary case or travel. But they redid the swab anyway, and now this one was also rejected. Okay. So what I would want to know is if the various health institutions have been keeping a log of all the persons who presented with COVID-like symptoms but did not meet the case definition to be tested by CAPA.
So that's a question for the CMO to answer.
So that second question, basically you're describing somebody that has flu-like symptoms, one. For a prolonged period of time, you said for a month. Generally speaking, the guideline as discussed with CAFA for a PCR test is the time we take the test and do the test is from 0, the day of onset of symptoms, all the way to 10 days post-symptoms. If someone is presenting 30 days later, what happens? The PCR sensitivity goes down after day 10. So even if you do a test 30 days later, chances of a false negative is very high. Their guidelines suggest that we only do tests that fall between 0 and 10 days of an illness. The CMOH offices will have listings of these persons because COVID is not the only thing that is infectious. There's other things, H1N1 and other pathogens around, so they would have listings to follow up on these persons from time to time to ensure that their symptoms resolve. But the most important thing is that they get the level of medical care that is required, and then, of course, isolation if they think something is infective.
Okay, the first question, I believe it was Dr. Rahman.
Dr. Rahman.
Thank you. So many businesses have gone ahead and developed plans that we are now looking at, and many of them have started implementing some of those policies and making the necessary changes already. I'm sure that you have gone out to businesses and noticed many supermarkets have erected the screens that I talked about, banks and so forth. So some of the larger businesses are well on the way to developing these policies and putting things in place, whether it be structurally or otherwise, to implement those policies. As for the smaller businesses, many of them do not have access to their business places as yet. So for example, mall operators, food courts within those sectors are closed off. So it is difficult for them at this point to get to their establishment to put some of those things in place, but we would like them to start thinking along the lines of what needs to happen so that they can successfully open and run their business. As regards the public health inspectors, currently under the legislation, they do have powers, and over time, as you know, some of these legislation have a timeline. We will see how the ministry changes those legislation going forward. But yes, we do have powers to enter, to inspect, and to make recommendations to those operators to make changes in their policies and their practices.
Thank you, Doctor. Newsday.
Olive Gonzalez.
Morning.
Would like to know, Mr. Deyalsingh, how concerned are you of a mad rush by people to any establishments once these restrictions are released? This is what is happening in other countries. And my second question, in the COVID-19 update, the ministry said that only one person is in hospital, but this person has been high dependency unit. I would like to know how is this patient going?
Well, the second one, as you know, we've spoken time. I can't give out personal details of individuals. We have one person there. Their status would have been communicated to their relatives and the person themselves. Going to a high dependency unit generally means your status is not improving between yesterday and today. So that's as much as I can say.
Okay. On the question of a mad rush, I have been at pains in this platform that we should not necessarily compare ourselves with other countries. I have said that publicly. Our dynamics are different, and we will do everything possible to ensure that when the Prime Minister makes the decision, he has all the information necessary to make a calculated, safe decision. However, at the end of the day, there's a lot of personal responsibility involved. And I want to extend my condolences to that person who died coming back from Maracas. I really do. Loss of life. Some children don't have a mother. But that is the type of situation that we have to avoid. And we could only avoid that if all citizens in Trinidad and Tobago adopt a sense of personal responsibility moving forward. As we see in this platform all the time, the virus is not going to adapt for us. We have to adapt to the virus. We have to change our behaviors. We have to change our expectations of what our social life is going to be like moving forward. And that is the best way that the citizenry can assist the government by changing their behavior, listening to the advice that is given out, adjust our expectations moving forward, and, the main thing is to protect and preserve life. The days of partying, drinking, that type of thing, we all need to readjust what we expect out of life moving forward. I hope that may not be the answer that is being looked for, but I think as a Minister of Health, as part of an executive, I think that is the best advice we can give to people right now. Thank you.
Thank you, Minister. We are almost out of time, so I just want to remind you all that the persons will be calling now based on how quick the hands go up. I'm just reminding you that you are to ask one question, please. Express.
Good morning, I'm Leah Soraya from the Trinidad Express newspapers. Minister Deyalsingh, forgive me if this was touched on in a previous press conference, but I know that sometime around mid-April, NIPDEC invited tenders for businesses to manufacture cloth masks. Could you say if these cloth masks are being given out, free masks are being given out to the public? Has that process started?
Sure. So there are two types of masks. The issue of NIPDEC is under the control of the Ministry of Finance. We would have said that tenders were received. They were supposed to be evaluated last week. I can also confirm that free masks are being given out by Feel. I spoke to Feel a couple days ago and this morning. Feel did do a massive distribution over the weekend of free masks. I spoke to them this morning where they'll be providing some masks to the homes for the elderly. Remember, we are treating them as a special population. And this morning, I really want to thank Ms. Carolyn Ruiz for working with the Ministry of Health. She's a doll to work with, and we are partnering with her to give her 1,000 masks through Feel. We did say publicly we'll be assisting them with some PPEs. I could confirm with the principal pharmacist, Anissa Sibu, that she has been in contact with Ms. Ruiz. And under 3 categories, protective garments, thermometers, and disinfectants, we will be assisting the homes for the elderly because we have signaled that even though they are not in the public sector, they carry a great responsibility in protecting our elderlies. And I want to thank Ms. Ruiz for her very cooperative stance with the ministry, and they will be receiving some protective garments, thermometers, disinfectants, and 1,000 masks from Feel. Thank you very much.
Thank you. I-95.5.
Once again, good morning. My question is for the CMO. Given the low number of persons now presenting with viral infection symptoms, do you think it would be prudent to expand this testing now to all medical facilities across the country as opposed to just 8 in Trinidad and 1 in Tobago?
Already done so earlier this week because as you would imagine with the numbers, and it's a very good question, as you would imagine choosing one particular health center, one facility, you may only see 1 or 2 persons coming in with that type of illness per day. So we did expand earlier in the week to include as many facilities as deemed by the county medical officers of health would be necessary to get our testing up to a substantial level. So they have taken the liberty to expand it, so they may test 2 persons in one facility as well as 3 in another one and get their numbers thereafter. We have not put any limit on them. If they get 10 or 12 or 15 for the day, they can take all of them and send them into the labs. So they have done that, I would say, starting late last week. We already did that. So it's a very good question.
Thank you. Guardian Media Limited. Chester, one question, please.
Yeah, yes, morning again. Quick question to the CMO. Well, the other Dr. Rahman spoke a lot about workplace policies after the stay-at-home regulations are lifted. But the minister just alluded to the days of partying and drinking. And I'm wondering, CMO, how do you tend to treat with such social gatherings after the stay-at-home measures are lifted? Could we see regulations still in place to safeguard against those type of gatherings or the amounts of people in them?
So that is a question for me because that's a policy question. We will be looking at all of these things. Right now, I think the gatherings are 5. As we move forward, post our first peak, we will determine what is safe for the public and bearing in mind the public's interest at all times. I can't give you a figure right now, but we must learn from other countries' experiences that flipped a switch, and then what you had a second and third waves which were bigger than the first wave. At the end of the day, we must bear in mind that the government could advise, put regulations as much as we want. But at the end of the day, a lot of it redounds to how responsible individuals are. Individuals, if we get the vast majority, we are not going to get all 1.4 million people being totally responsible. But if we get the vast majority to be responsible, we could limit the spread of COVID, we could limit and mitigate against community spread, and we will not bring down our healthcare system. That has to be the goal. That has to be the goal. The goal in all of this has to be a high degree by the majority of the population to engage in some personal common sense responsibility. Thank you.
Thank you very much, Minister. Thank you, doctors. Thank you, members of the media. Thank you to the viewing and listening audience. We have come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. Here is a reminder that you can find all government information on COVID-19 in one place. You can go to the website www.covid19.gov.tt. No need to scroll past non-COVID-19 related information on our website to get the facts you are looking for about the virus. The Ministry of Communications created a website that has all things COVID-19 related. It is a one-stop shop for all the releases from the Ministry of Communications, all the releases from the Ministry of Health, public health guidelines, public health notices, the highlights from the day's media conferences, along with videos, podcasts, and other educational material. In case you missed it, the website can be accessed at www.covid19.gov.tt. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its effort to flatten the curve and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago.